Way too rigid up there.
Does the state of Florida make you register those elbows as
Ha!
weapons?
He should. That's right.
Take your pants off.
There's your problem. That's got to go in. And then this is where the skin folds. That's where all the folding. So we're trying to make folds up here. Tell me about yourself. I know you're a dentist and you were going to come in just for a regular checkup, but something happened last week. Go ahead and...
Yeah, we've had this appointment for months, and the idea was to come in here and just get a tune-up and learn some stretching and learn some maintenance techniques. But then, as fate would have it, CrossFit reared its ugly head, and so now I have L4, L5 stuff going on, and tried to play basketball on it the day after it happened, which was a big no-no, and I had to stop. And so for the last week, I've been stretching, trying to get things feeling better, but getting out of the car hurts, sneezing hurts. And so now I suspect, just from a little bit of homework watching your videos, there's probably a tight mid-back contributing to it. But yeah, so the appointment's going to take a different flavor than I thought it would, but
Okay.
Here we are.
Give me an idea of what you were doing. Can you show me?
Yeah, so it was
More specifically?
so like ground to overhead, that stand up.
Yes.
That didn't really bother it. I think it just weakened it. Second workout the day after was just deadlifts in rapid succession. So it was light deadlifts, 10 at a time, fast against the clock. That was the issue because by set 7, I'm sure I was rounding forward and not keeping what semblance of a curve I have. And then the third day was rowing, ground to overhead, and then weighted sit-ups with the weight going in the back, and then taking the plate, and then just doing kind of like the snatch motion.
Okay.
So all that, 3 workouts in 4 days. By Friday, trying to play basketball, I was just eviscerated.
Do you keep a back brace on your lower back when you're doing that? No?
Probably should have.
Okay, I'm just curious.
I will now.
All right. Go stand up for me. I'm going to rest your posture here for me.
Yeah.
We'll look at you.
How tall are you?
6'7".
Holy moly. That's 6'2". I'm like, you're making it look small.
Head's about an inch forward. And I know your work requires a lot of sitting, and that's where we're going to talk today about how to counter stretch that and counterbalance that. Hips are not too uneven. All right. So go ahead and sit down for 1 second. The local pain in the lower back is going to be the joint giving you, is inflamed. When you're doing those activities, like you already mentioned, the lumbar curve, straightens out a little bit. That destabilizes the joint because the joint stability comes from the contact of overlap. So the more they're overlapping, the more stable they are. When you separate the joint, there's a rubber band, a ligament that holds that joint together. That's what gets stressed out. That's what we sprain our back. Now the muscles get tight in response to that injured sprained joint. The nerve is sandwiched. I'm going to use this area just because it's a little easier to see. So you have the joint behind, then the nerve, and then the disc in the front. Like I said earlier, when we have the posture not correct and years of sitting and excessive mobility down here, the joint gets injured and most likely the disc gets injured in conjunction, and the nerve is trapped in between. The nerve is going to give us more of that groin, and as it progresses, it will go down farther, weakness in the leg, organ dysfunction. They're all tied with the health of these nerves down here. So if you make a joint overwork, just like a muscle grows, a joint will grow. That's what we term arthritis, arth meaning joint, itis meaning inflammation. So if there's excessive motion down here due to alignment and mobility, the joints will grow. Obviously that pinches the nerve, causes what we call stenosis. The bone grows into the foramen, so now there's less space for the nerve to travel through this intervertebral foramen, and so that causes pain, pressure. The nerve can't distinguish between a bone hitting it or a disc hitting it at 33. More likely there's a disc involved versus bone growth at 33. This is where an MRI, I don't need it to treat you, but many doctors typically would want to see, does your spine, to me, look age appropriate? You're 33, I expect to see a 33-year-old MRI, not signs of an area looking 50 or 60 and evidence of accelerated aging. How long do you want to live is my joke. If you want to live to 50, just
Keep doing what you're doing.
Keep doing what you're doing. But if we want to make our spines make it to 90, well, this is on a crash course to be done at your age of 50, 60. So I look at what is termed as the unremarkable. So everybody focuses on the areas that are injured and tries to do some sort of manipulation to pop it or crack it or make it feel better. And I go, well, this area is only hurting because it's overstressed. And the activities that you did, I ask an inverted question, why, when you were doing that activity that just showed us, why did this area not get injured, right? So your traps, your lats, your diaphragm, quadratus lumborum. You got a lot of muscles stabilizing and stiffening your middle back, along with the ribs that aid in rigidity, and that allows this area to sort of just sit on the sidelines and observe. And I noticed you said another guy doctor had difficulty loosening your middle back, and that's what we're going to explore today, because that is the reason for why this gets overstressed. And then we're going to then end our visit, and I'm sure you've been watching me of this, the lumbar lordosis, the restoration of that curve is going to give you the ability to maintain your own spine, and the ability to even injure this to be a lot less. By bracing this, it makes this more likely to show up. It's a firing order based on who's the loosest. Whatever vertebrae is the loosest moves the most, the one that's the stiffest, and there's no ribs in the lumbar, so the lumbar area, typically the lower first, is where all the torque happens. And I love dentistry because the enamel has no feeling,
Right.
and neither does the disc. And so a lot of doctors, want to go down the road of, well, scale of 1 to 10, tell me about your pain today. And the difficulty is that the disc takes 10 to 15 years, and probably similar to a cavity in a tooth doesn't just form in a week or a month. It takes years to finally hit the nerve root in a tooth. It takes years to have a valsalva, which is what I sneeze or I cough, and it causes pain. That's because when you increase interabdominal pressure, it makes this disc move out just a tiny bit, hits the nerve. We want to treat that seriously. We want to take the pressure off that, even maybe to show you a little bit about how to ice that area when that happens, back brace. But we're going to transfer the work up to your middle back. The last component that I want to talk about is that the alignment of your head to shoulders affects your middle back also. So go ahead and stand up for me. I want you to feel on my back. Give me your hand. When you're upright, there should be a suppleness to your middle back.
Mm-hmm.
Now watch what happens when my head goes forward. Feel?
Yeah. Tension.
Tension, right? So when I looked at you from the side, I'm dealing with, and because your work necessitates, your head hasn't, the rubber bands that are supposed to, like a drawer, like one of those self-closing drawers, you open the drawer and then you let go of the drawer and it automatically shuts. That's what our posture is supposed to do. We bend forward, I come up, my body's supposed to go back to center, but your center has now changed to about an inch forward. So ultimately, this middle back stiffness can't ever go away if the head, so Ed, it's down, here's my pain. I didn't told you I didn't have any neck symptoms. I know, but your head's forward.
Right.
And so ultimately the middle back stiffness will just keep coming back, and the ability to overstress the lower back will just keep happening. And then the other difficulty, even I think some doctors don't want to deal with it, is that we might run into things. As we bring your head back, Ed, now my neck's hurting. What I came in with just this, but that was because you're in avoidance. Your neck was forward because of work, but also because there's joint injuries, or even there could be disc injuries that we aren't aware of. Unless we have an MRI, we're flying blind here a little bit. It's, what do we say, plausible based on your activity and your work that the discs are under, at least, the very least, overstressed, and they're probably a little bit older than you are. So that's probably why your head's going forward, middle back gets tense, and then when you do activities with the wrong alignment, that makes these type of injuries happen more likely. All right, let me see how your middle back's moving here. Yep. All right, I'm gonna help you do a little sit-up. Take a deep breath in, a little sit-up. Head back for me. Let all the air out. Deep breath in for me. There we go. Exhale. Beautiful. Exhale. Let it go. Here we go. Yeah, hold tight there. There we go. Deep breath in. Exhale. Resistant,
Yeah.
right?
Yeah.
So I'm gonna get that better than that, but I would give that like C plus B minus. You understand? It's not a fail rating,
Yeah.
but I had to pretty much go as hard as I could, and I got a okay level of movement.
Right.
There should be a sveltness to the middle back mobility.
Nothing spelled about that.
Right. Well, some chiropractor might go, well, see, it popped, it moved, I'm happy, right? And I go, well, it moved with a lot more force. It's like a bolt or a door or a hinge. It's not supposed to be that hard to get the joint to move. They should be just butter. Exhale. Yeah, we gotta get this middle back a little better. Deep breath in, exhale. I'm just trying to close this middle back. There we go. All right, deep breath in, one more. Exhale. All right, other side for me, okay. Other side, yeah. We're trying to move this joint, and we're trying to move this joint without
Right.
and your lower back's saying, I'll do it, and it's like...
In the line of fire.
In the line of fire, yep, okay. Breathe. There we go, good. Breathe. Oh, it's okay, face up, it's okay. I didn't want to go any harder than that. His lower back is so loose
Yeah.
that the chance of, what do I say, I want to do soft tissue work on him before, we might try that again at the end. The possibility of further stressing the part of his back that's already overstressed is high because it's the area that's moving the most. If somebody feels your neck that's a practitioner and doesn't immediately feel this, we got problems. It'd be like, I don't know, one tooth totally rotten in the mouth and all the other teeth are clean. You know what I'm saying? It should be immediately perceptible. Huge misalignment of this one bone up here. It's a left favoritism. You like to sleep on your left side. You like to, your work must require, and so the bone is, when you tilt your head left, the bones shift to the right. Your head is straight on your torso, yet the bone is sticking out on the right here. Let me show you. Right about there. Right about there, I got the bone level. But now your head's tilted 15, 20 degrees to the right to make the bone level. Now your head's straight to your torso, but the bone's crooked. This will eventually lead to left lower neck, left shoulder, left arm issues because of, if you can follow me, you have an injury on the right side, head's tilted left, bone's sticking over here, and you're going to pinch the left lower because of, so it's not even really about the sake of the right side, it's the health of the left lower neck that's going to suffer. It's just like an alignment of a tire. We know where the tread's going to wear out prematurely based on this alignment. Real easy here. Here we go. I got you. It's okay. There you go. There we go. You okay? Yeah. I got your head. Try to push that in. Yeah, a little deeper. Here we go. Yeah, wow. Okay. Yeah. Way too rigid up there. There we go. Come on. That's what we're journeying in this way. There we go.
Proper ergonomics, kids. Don't do things the wrong way.
Right. Oh, man. Yeah, that needs to be. The drawer has to be first leveled, and then we can push the drawer in. If the drawer's crooked and we push the drawer in crooked, it's like, geez, it's still crooked. You know, I want to level this out first. Yeah, this is what they would detect on an MRI. They would say left disc injury. You know, that makes sense. That's because of the alignment, because of this up here, throwing all the work down to the right lower.
Makes sense.
Yep. My joke is always, of course, you don't crack the teeth that you don't chew on.
Right.
You don't wear out, the football players that spend their whole season on the bench never get concussion. Only the parts of the back that are working are the ones that get damaged, and so if people have a favoritism with their bite, or those are the teeth that. There it is. There we go. The side of the vertebrae is actually elevating the muscles on that side. And that's where people always ask, what are you rubbing? It's like, well, yeah, it's the skin and the muscles ultimately, but the vertebrae underneath is, the tree root underneath is pushing up the bricks in the driveway. Of course, the bricks need to be moved, but it's the tree root underneath that's the problem that moved everything.
See that position right there, the subtle tilt to the right, that's where you spend a lot of your time, working if you're right-handed. So that's probably what's to blame for that.
Popping it out, yeah. It's going better. It's actually changing. It just, your neck loves, yes, no. That's the problem. And just, nobody says anything until it's all too late. And it's like, well, thanks, guys. So nobody does any health care. There really wasn't any preventative care on my spine.
It's hard for the lay public to be proactive when there's no sense of anything wrong. That's the issue.
That's right. I go to Disney or I go to the Apple store and everybody's looking down without a care in their world. Just necks all L-shaped, looking straight down. It'd be like everybody chewing on hard candy or grinding their teeth and not understanding that your future is not going to be good.
You see it and you feel like you're taking crazy pills.
preaching. I do. I think we talked about this earlier, but I admire that, at least dentistry has done a good job of educating everybody in terms of that they have to participate. But with our spine, we're just left to just, well, how do you feel? Okay, that's not how dentistry works. The dentists don't say to me, all right, Dad, I'll see you later. I'll see you when your teeth hurt. It's not how the car mechanic treats me. They never say, okay, I'll see you later when your smoke's coming out of your hood. That's not how we treat our cars. Not how we treat our teeth. But somehow our spine, we're just left to just, well, how do you feel? Okay, half the spine has zero feeling. That's a very poor way of viewing spinal care. Alignment, mobility. How does it feel? Rub it, feel it, touch it, palpate it. Chiro means hand. Put your chiros on it. I had a patient who had an injury and I gua shawed him. He had these huge gua sha marks on his back, and it was a workman's comp type injury. And so he needed to go to the hospital to have him document it and, file it and all that stuff. And so I said, okay, well, when they see the gua sha marks on your back, don't let them freak out. Yeah. And so, explained it, don't say it was a chiropractor, say it was some sort of, so he goes to the hospital and he comes back and I said, okay, how did everything go? And he goes, oh, it was fine. Yeah. I was like, well, what did they say when they saw your back? I mean, it was bad. It was like one of my worst, like one of those bad videos. It was a bad mark all over the back, but he was feeling better. He was doing good. But I said, what did they say when they saw your back? He said, Ed, they never even made me lift my shirt.
Oh my gosh.
They never even looked at it.
Wow.
Let alone, like, stand 20 feet away and just lift your shirt up and do a circle, They never even looked at his back. I forgot. I was like, okay.
They got to put their chiros on it.
They don't even touch. They didn't even touch it, let alone even look at it. Big mark coming out here. So the bone's not in the right position. The muscles are having to work harder to hold everything together. The alignment's supposed to give you stability, but because the bones aren't in the right alignment, now the muscles are trying to be the thing that holds everything together. It's not really their job, but it is a secondary function that a muscle can provide is stability. Somebody went way too far down that road. Well, muscles can give stability. Is that what you said, Dr. Ed? Yes. It's not their job, but they can. And so we then went 10 more steps farther. It's the job of muscles to give you stability. Let's strengthen all your muscles to make you more stable. My problem with that is, how long can they do it? Right? Muscles fatigue. How long, if I give you something to hold, can you hold it? Eventually, you're going to fatigue out the muscle. Your lordosis, the joints, the discs, the ligaments, those are what's supposed to give you stability. When those areas are injured, muscles come to the relief and aid, but it's not their job to be constantly tight to stabilize you. The mark only comes out where there's something internally. Like I combed this.
Yeah.
It only comes out where there's the plaque. There's a big wad of plaque right there.
Wow.
Deeper here. Let's see if I get one more. All right, done. Good. All right, we got it pretty closed. Yeah, it's elevated on that side. It should, these, you see the ribs are all down on this side?
Yep.
The ribs are all down, and then this is all popped up on your left. A little bit of a Belgian road washboard, right here. There's gonna be more mark on the left side. There's some fun right there, but yeah, right here. All right. I see what I'm up against. I see it.
Does the state of Florida make you register those elbows as weapons?
He should. That's right.
How do they feel?
Outstanding.
Not here to overwhelm you, but I am here to push you. It's like a physical trainer.
Yep.
If your physical trainer is too nice, then we're not going to get any results. And if they're too mean, you never go back, and so you never do anything. So the goal is to find where that edge is and hang out there, and then as the care progresses, that edge moves, and we can get to a place where, yes, the entire visit is a joke. Nothing should be hurt. There is no normal pain anywhere. I don't accept any of it. There's no normal plaque. It's all build-up. It's all injury. It's all lack of proper cleaning. I don't accept. People try to go down that road of like, well, maybe it's genetic. No, sorry, don't.
Yeah.
This is life, injuries, posture. I mean, yes, there's a small percentage of things that can be genetic, but a vast majority are And yeah, a tooth can maybe not form properly, right, or something, you know, I don't know, there could be some sort of, maybe didn't have enough material or folic acid or whatever, you can educate me, right, and the tooth just didn't, and that's why it's got a more prone to a cavity, but 99% of the time, it's because you didn't, you know, you injured it cracking on your bite or.
Yeah, my favorite one is the baby stole my calcium, and like that's why I bet people develop issues while pregnant.
There you go, okay.
It's a common one we get.
Fallacy, yeah.
Alex is loving this right now.
Oh, good. Good. All right, yeah. We're going back to that left side in a second, I know.
Make your sleeves even tighter.
Get the subscriber count up.
We need more subscribers.
Pump up those numbers.
That's all. Just kidding. Take your hands off. That's funny.
I need those breakaway pants. Dark up here. This is the cause effect. You know, back brace, ice. You know, leave that area alone. It can't be helped by being manipulated. There's a significant, you know, clog up here, and I fixed too many of this and other people by just clearing this and getting the curve back after a handful of visits. I don't even feel my lower back anymore. My middle back's killing me, but now my lower back feels great because we're going to move all the workload up to here. And they're not just, you know, it's to just use, if you just gave me adjustments, this would take a while.
Yeah.
If my only tool that you're going to allow me to use to loosen your middle back is that, it's possible, you're going to have to do a lot. See you tomorrow, see you tomorrow, and it takes a while while we can get it done in, you know, very expedited fashion. Now obviously this makes it more sore. That whole section is. Yep.
Does it hurt, Alex? Or?
No.
No, yeah, it just feels like your back's getting itched and take a peek.
Oh my God.
Yes, I know. I told you it's on his left side.
Wow.
There's some over here.
When he
You're gonna
sees
see
that, he's gonna freak out.
it's about half. This right side will be. I mean, I'm going at it. I mean, there's just not as much on the right. There's some right here, like right there. There's
How interesting that is.
when there's internal motion, it washes itself. So the left side's stuck. The right's abused, but at least the abused side is moving, right? So there won't be as much congestion or blockage internally because of the mobility. The excessive mobility is washing the tissue. The area that's frozen, stuck, is where you find the most stagnation, where the most plaque builds up.
Wow.
But this is the. Got some rib injuries, some collisions over here.
Basketball.
Yeah, there's some. Right there's a collision. Yeah, there's some. It's a lot less facet, a lot less vertebral facet, much more rib on the transverse. There's tension here. Nobody's ever worked in this area, huh? Nobody, yeah. A whole new world. The final frontier.
He does get massages, though. I mean,
But nobody works the glutes, right? Nobody's working this joint here. Some percentage of why your lower back is.
Yeah, and it radiates right to that point.
Mhm.
Yeah.
Right there, it's just way too tight. There it is. Perfect, there you go. Yeah. Yeah, see, it's like a 2x4.
Yeah.
There's your problem. That's got to go in, and then this is where the skin folds. That's where all the folding. So we're trying to make folds up here,
Wow.
and that's what we're going to do in a second. So you got to be even careful with Cobra right now because you're over,
Oh, yeah. So,
right. You see what I'm saying? You're bending too much down here.
How different your face looks different.
No, you push the space in there.
Smashed. Yeah.
That's the whole left side there. I mean, there's half or the ribs over here, but that whole. Thank you. Wives are the best.
I know.
You gotta take care of us.
When the nitpicking pays off. Yeah.
But you're saying that's what we're dealing with there. We gotta. The alignment's what creates that. Right. Wow, what a monster ankle. Wow, monster. Jeez. That is a monster ankle. Jeez. There we go. Grip. There you go. Whew. That felt good over here. Wow. I pick up a lot of legs, okay? I mean, it's like, I pick up a lot. All right, okay, go ahead and tilt your head to the right, tilt right, keep tilting your head right. Keep tilting your head right. There we go, here we go. Go ahead and tilt your head to the right for me. Okay, I got you, hold on, don't tilt left. There we go, all right, good, go ahead and tilt now. There we go. There you go, tilt. There we go, good. You're pressing the vertebrae and then you're rotating the vertebrae to free up the adhesions in the joint, and then you also mainly are stretching the front part of the body. So there's the anterior longitudinal ligament that runs from the front part of your foramen magnum down to your pubic bone. That ligament is never stretched through most of life. That's what you're stretching segmentally here on the dental. That ligament defines your posture. Whether or not you have a curve in your back is based on the tightness of that ligament. If the ALL is real tight, then it pulls the curve out of your spine. There are practitioners that want to strengthen your back muscles to counteract the tight ligament. I go, how about we just stretch the ligament? You don't have to have the tight back muscles to play fighting, tug of war on each other. And that's it. It's a 20 minutes, 20 times for 20 minutes is your first goal with these stretches. That's not to say that 5 minutes or 10 minutes is not beneficial, but you're not going to see a permanent change in your ability to lay on this easily or even an improvement of your lumbar curve until you get to 20 minutes. They call it ligamentous creep, is the lengthening of those ligaments that define your posture. They take about 20 minutes, 19.5 minutes to fatigue. The table work is done to make the back not so inflamed so you actually can even do it, right? If the back is rigid, then you're not even going to bend properly, so then you're just wasting your time on this. And then they both work hand in hand to move up the ladder of, now I can go stretch longer, I can stretch deeper, my adjustments are getting better, and you get to a point where this becomes your chiropractor, where you're interweaving this throughout your day. I'm going to show you the wrong position so it becomes more clear where it's supposed to be real quick. I'm going to show you. So if it's too high, let your head relax. So obviously, like this is too high, your chin is down.
Yeah.
Get the idea? Nor do I want it all the way down in the lower neck either, right? Where your head's, and then the back of your head's touching the ground, right? It's too low.
Okay.
So it's kind of a Goldilocks right in the middle, enough that your head goes over it. I usually sometimes take my hand, I'll press it in my forehead to get my head to sink into it. Get the idea? And then 20 minutes. To get off this, you just use one hand to lift your head without engaging your neck muscles, grab the device, and then lay your head back down.
Okay.
So don't just lift your head up off the device. Try to passively.
Got it.
Just stay here for a little bit.
Okay.